Hi everybody, this is Doug Ringwald at Coaching the Body. What I'm going to show you today is how to quickly hack sciatic pain with a vibration tool on the hip muscles. What most people don't understand about sciatica is that it's usually not due to an impingement, a nerve impingement at the piriformis muscle or a nerve impingement in the lumbar spine, which is most often what it's diagnosed as. Usually it's referral from muscle trigger points in the gluteal muscles, and these are easily treated. Trigger points and how they refer pain is not well understood by most medical professionals, but it's well documented in the medical literature. For instance, the glute minimus muscle, right here, is known as the sciatica muscle because it refers a sciatic pattern of pain down the leg. It can be misdiagnosed as IT band pain, IT band syndrome, lateral knee pain, lateral ankle pain. It often will refer into the lateral lower leg. It also will very commonly refer into the posterior leg in the back of the leg, as well as the posterior calf, and sometimes even down to the heel, and then sometimes people will feel it even in the bottom of the foot. So you can get diagnoses like plantar fasciitis, all sorts of calf pain issues, all sorts of pain in the lower body, in the lower leg, thigh, can be diagnosed, misdiagnosed. Trigger points are micro areas of stagnation in muscle fibers. They make a muscle dysfunctional, and then they also will refer their pain pattern. We can change those trigger point fibers and make them healthier and able to respond to the motor nerve effectively again with using vibration as a neurological distraction, simple movement, or what's known as contract relax or post-isometric relaxation. So that's a lot of words. It doesn't really matter. What matters is how quickly you can do this on yourself with a vibration tool. So here goes. I'm going to just turn this on, and then I'm just going to cross my leg over. So it doesn't really matter. I have a lot of range here, and you know, if I lean into it like this, this is externally rotating the hip, and that's going to put stretch into these gluteal fibers that are often the cause of the sciatic referral. So if I just lean forward like this, I actually can feel like there's some stretching or something happening on my lateral leg, but there's nothing happening here mechanically, because in order to change the length of this quad here, I have to, that's shortening it, that's stretching it. I have to bend my knee, but I'm not changing my knee at all. What I'm doing is adding external rotation to the hip, and that is causing the sensation in the leg. So when you do this, you might feel all sorts of, you might feel something along the back of the leg, lower leg, or even the posterior leg. That's common. That's that referral from these muscles. So what I'm going to do is I'm just going to move this passively with the vibration on the hip. So the area I want to get the vibration on is between the greater trochanter here. I can feel this round bone of the femur and the iliac crest, the hip bone. So between here and here, gluteal fibers are in a fan shape like this. So I'm going to run the gun across those fibers as I move my leg. So all I have to do is get the vibration happening, and then I'm just going to bring my knee towards me, push my knee away, and I can change where the vibration is. I'm going to shift a little bit so I can get the gun here in front of the chair back. So basically, we're just moving the hip muscles through range of motion. This is shortening them. This is lengthening them. And it doesn't matter what your range is here. You know, you might be way up here and just be moving a little bit. It doesn't matter. No matter what the range of motion is, it's gonna help. So after just doing this for 30 to 60 seconds, then now I'm going to do contract relax. So I'm going to engage the hip muscles hold my breath for about 7 seconds, and then on my exhale I'm going to relax the hip muscles and then push them into the external rotation stretch with the vibration. So I'm going to push, all I do is I push my knee up into my hand, so I'm going this way and my hand is blocking and I can feel the hip muscles engage. I'm going to hold that and inhale and hold that for about 7 seconds and exhale. Then I'm going to relax and then I'm going to lean forward, pressing my leg down, externally rotating these hip fibers, and I'm going to move the vibration along those glute fibers. And when I do that, I'm masking any stretch pain. I don't really feel anything. Okay, now I'm starting to feel, when I get to my end range, I'm actually starting to feel a little bit of medial knee issue. And you might feel something when you do this. You might not feel anything on the outside of the leg. You might, which that's common, the glute referral, but you might feel something on the inside of the leg, even going down to the knee, and that's going to be the antagonist muscle, Adductor Magnus, sending its referral. So it will refer into the medial leg and sometimes all the way to the medial knee. And if you start to get any of that, then you can just treat that muscle. So I'm going to show you how to treat that muscle. Let me see what my range is like now. Yeah, now I can go a bit further and I don't get any of that referral pain. So you might find the same thing. Now, if you did get something on the inside of the leg, any discomfort, pain sensation there, like I was starting to get some of this medial knee pain here, we're going to treat the adductor magnus, the antagonist muscle, the biggest antagonist muscle to these glute fibers. So that's going to look like this. All I have to do is stand up and then put that same leg up on top of a chair. And then if I just lean in front of my leg like this, that's going to be a big stretch for this adductor magnus. And if I get really, I have a lot of range, but when I get towards the end of my range, I actually start to feel the stretching, and then I can actually feel the kind of achy knee pain. So I'm going to just put the vibration on there as we do a contract relax. So first I'm just going to get this vibration on the medial and posterior adductor area and just move a little bit. So I just come down like this, come back up, come down, come back up, and now I'm going to do my contract relax stretch. The other pain you might feel is groin issue. So the adductor magnus along with the adductor longus, those muscles are the leading cause of what's feels like groin pull. It's actually referral from the adductor muscles. And I'm starting to feel a little bit of that. I'm going to do my contract relax. So I do my contract relax stretch basically with the vibration going. And so what that looks like is I'm going to put my arm in front of my knee here, and I'm going to push my knee into my arm going this way. At the same time, I'm going to push my heel into the chair. So that's really engaging the adductor magnus muscle. I'm going to hold that for about 7 seconds with an inhale. Then I'm going to release that and exhale, and then I'm going to come into the stretch. So I just lean forward. Okay, and now doing that with the vibration, I didn't really feel much. I just kind of felt my end range. And I'm not feeling any medial knee or groin issue. I'm going to come back to my original position and just come back to my original cross-legged stretch and see what I feel now. Okay, no knee pain and no lateral leg issue. So that's how quickly this can work. So I encourage you to give this self-treatment a try. It's very quick. You can do it even without a vibration tool. If you just want to do the contract relax, you can do this at any point, even if you're starting to get any pain in the legs or anything from sitting for a long time in front of a computer or whatnot. You can just even do the contract relax portion, and it's going to have a beneficial effect. You can really enhance that by using the vibration. At Coaching the Body, we have a more in-depth video of how to do this type of self-treatment for sciatic pain, and that is going to be linked in the description. I encourage you to give this treatment a shot and let me know how you do in the comments of the video. Thanks.